the call.
Good afternoon, Yvonne. How are you doing?
I'm good.
Great. Right. Everyone, let's start our session today. So today, the title is about how we can use the electrical stimulation for a faster recovery of hand for patients with strokes. And I do an introduction about the webinar. So this webinar, the purpose of the webinar is we hope that we can share some useful knowledge for both health professionals, caregivers, and even patients at home that to fasten their recovery. Because stroke, we understand that it's not an easy process. It's really require a close effort between the health professionals and family members together as well. So, so during this sharing session today, basically we hope that we can share some practical tips. Yvonne is going to share practical tips, and then some of the clinical evidence, recent clinical evidence that used to support what we're sharing today. And I would like to introduce this webinar is co-organized by YK Nigeria Physio and Academy together with Techcare Innovation. So a quick introduction about YK Nigeria Physio and Academy. YK Nigeria Physio is a rehab center located in Johor, treating patients as well as also providing trainings or different equipments and devices. Right. Techcare Innovation is a technology company. I myself is a biomedical engineer. We do develop R&D devices as well as provide a solution to people to improve the rehabilitation process. And the main goal is how we can increase the recovery rate of the process. Right. Let's straight to the point. I would like to introduce our speaker today, Yvonne. So for those maybe the first time who joining us today, Yvonne, I would like to introduce. Yvonne is a senior physiotherapist. She's also the founder of the YK Nigeria Physio. She has a master in rehab technology as well. So far, currently, she has accumulated of 8 years of experience in the field. Also instructor from some of the, for example, kinesio tapings and some devices as well. So I would like to start the pass this floor to Yvonne. Okay, Yvonne, pass it to you.
Hello, everyone. Good afternoon. My name is Yvonne. I'm a physiotherapist with 8 years experience. And I also have a master in rehabilitation technology and also bachelor of physiotherapy. So today I'm very thankful for Techcare to give me the opportunity to share about what is electrical stimulation and how electrical stimulation able to help in hand recovery from stroke. As I know, after stroke, patients will experience the dysfunction from their upper limb or lower limb. So through the 8 years experience, I found out there is no protocol or no, which is like we do strengthening only, it will help stroke patient. Or otherwise, like we just only use electrical stimulation, or we so-called the acupuncture, or we call robot. Just only one method can treat the hand recovery from stroke. There is no protocol. So I feel that there is a big gap and a big area we need to be improved to get more knowledge from different type of method in treatment. Then it will help to improve and shorten the recovery from stroke. Okay, now we straight to our topic today. What is electrical stimulation? Okay, electrical stimulation is a technique used to activate a muscle contraction using electrical impulse. From rehabilitation, we are usually use the transcutaneous electrical nerve stimulation. Okay, then electrode is controlled by a unit which is placed on the skin over a area which is we want to stimulate. For example, others electrical stimulation, for example, is a pacemaker. Pacemaker, we need to go through surgery and put inside near to our heart. But for electrical stimulation in rehabilitation stroke, we are not put inside the muscle. We are put outside the muscle and outside from the organ. Okay, that's why electrical stimulation in rehabilitation, we are usually call it transcutaneous electrical nerve stimulation. The electrical that generate from the unit, which is we call the machine. You can see the photo here. This is the machine. From the machine, then they go through the wire and go to the electrode, then develop into the muscle and cause it contraction. Then when we need to use in stroke, how to use in stroke, that will be taught in later. Now, one thing we need to know is the criteria for electrical stimulation in stroke. When we need to use, first, when you see stroke patient having muscle weakness, we can use it. Yes, we can use. Second, if the stroke patient having experienced the muscle pain or joint pain, because as I know, I treat a lot of patients with stroke, they will usually have a shoulder pain after they getting stroke. Maybe due to the muscle weakness, or maybe due to the sensation is a bit reduced or causing pain, we don't know. But electrical stimulation can help to reduce the pain also. Third, no movement. When the stroke patient, they're not able to perform some movement on his joint or hand or ankle, it also can use the electrical stimulation. Last is the muscle spasticity. Can it use to reduce the muscle spasticity? Yes, it also can use. So there is the 4 criteria. It can be, we can use the electrical stimulation to apply in stroke patient. Okay, there are a lot of types of electrical stimulation, but commonly we use in rehabilitation in stroke are 2. One is neuromuscular electrical stimulation. Okay, and second is the TENS. We call transcutaneous electrical nerve stimulation. Okay, what is the difference between these two? Neuromuscular electrical stimulation, it helps to activate muscle in stroke patient, movement education in stroke patient. Third, strengthen the muscle. If the patient not able to perform the muscle movement, we can use NMES to strengthen it. Fourth, we can also use it to reduce muscle stiffness. How? Never mind. Later, have a slide, we will talk about this. Then last is to increase the blood circulation. Because for stroke patient, they are reduced movement. So no movement, the muscle don't have the contraction. Then the blood circulation towards the part, it also will be reduced. By putting this NMES, it also can help to improve blood circulation. So patient won't be easily feel cold or feel swelling because of the muscle contraction and so on. Okay. The second is the TENS, transcutaneous electrical nerve stimulation. It can usually use for stroke patient. We are reducing the pain. Like just now I say is the shoulder pain, wrist pain, or elbow pain. This is the few part. It will be experienced by stroke patient. Others than putting, we call salon plus to reduce the pain. We also can use electrical stimulation to reduce the pain for stroke patient. Okay, I think most of the audience come here. Some are physiotherapists, some is stroke patient family members. So we got the TENS, we got the machine, we got the electrical stimulation machine. Then how to use? Is it same? We can follow the manual from the machine. Yes, for pain, for reduced pain, or for reduce the discomfort, you can follow the manual from the machine. But so-called we call stimulation, that will be different. They have a specific part we need to put on to stimulate. That's why this is the purpose for today's webinar. And if those family members or from stroke patient, if you have a machine need to stimulate, it's better consult from your therapist. From here today webinar, we are just sharing some example. Okay, like just now I say, the electrical stimulation can help to reduce pain, reduce spasticity, reduce swelling. The last one is increase muscle strength. Okay, how to reduce the pain? Okay, here is an example for shoulder and wrist. You can see the photo on your right side, which is the shoulder. You can see the 4 electrode, right? 4. Usually for the shoulder, because it's a big area, we are advising to put 4 electrode, which is crossed. Then the current generate, it will go in more deeply. Then you only can go into the joint to reduce the pain. Okay, what is the duration? We are usually advised for less than 30 minutes, about 15 minutes, usually in physio center, or we can use at home. Then the left side, the photo, you can see the wrist. Wrist, why we just put 2 electrodes? Because wrist is a small area, and the muscle is not so thick. It's less than half from our shoulder. So we don't need to use 4 electrodes. We use 2 electrodes, generate the current and go into the joint. It will help us to reduce the pain. Okay. Then this is some clinical research, which is we can get from Google Scholar or from the internet. Okay. We also say that TENS, so-called TENS is the machine. The machine use the mode which is called TENS, can reduce the acute and chronic pain from the musculoskeletal, no matter is in stroke or in musculoskeletal, such as neck pain, lower back pain, for normal people who experience their joint pain. Okay, so it is good to be used and to help patients to reduce the joint pain. Second is the reduced spasticity. Okay, now come to a question. I saw the question, some people will say, the TENS machine is to reduce the pain, right? And to stimulate it, is it maybe will increase the spasticity? Yes, also, it will increase the spasticity. That's why reduce spasticity, they have the way. You need to put, and they have the procedure you need to follow, only can reduce the spasticity. Okay, for those they have a spasticity, they put the EMS in the wrong place, which will make the patient more spastic instead of reduce the spasticity. Okay, so here is some example. You can see the first photo, which is from a stroke patient, have a synergy pattern. We call synergy pattern is have a fraction pattern. You can see wrist is in a fraction pattern, elbow is in a fraction pattern, right? Then how we want to reduce the spasticity? Okay, we use the electrical stimulation is EMS or NEMS. Like just now we say neuro muscular electrical muscle stimulation. So we already said stimulate means start off, means strengthen. So we need to put the opposite muscle from the spasticity. You can see the second photo. You can see elbow is in a fraction position. That means which is a spastic. We can say the elbow flexor muscle is a spastic. We can't put the NEMS on the flexor muscle. We need to put on the weakness muscle, which is called tricep, which is the extensor from the elbow. So it can help to reduce the spasticity. And the second photo, the last photo you can see is the wrist. You can see from the first photo, the patient experienced wrist flexion. That means the flexor is tight. The extensor from the wrist is weak. So we can put the NEMS on the wrist extension. This also helps to improve the strength on the on the wrist extensor and reduce the spasticity on the wrist. Okay, this is the one example. No, sorry, this is the two examples how you use to reduce spasticity. Others than using the electrical stimulation, from my experience, I advise don't straight away put the electrical stimulation on stroke patient. Why? Because stroke patient, maybe they have abnormal sensation. We don't know the abnormal sensation is either aggravative or subside. Some patients, they can't feel any sensation on the stroke side. It may be, or it may be aggravate. That means I just touch a little bit, but for him, maybe it's a pain. That's why for reduced spasticity, this treatment is better go through a therapist advice, only you can use at home. Okay, now we need to do some stretching for warm up. Okay, at the first photo, you can see before we put the electrical stimulation, what we need to do some stretching, loosen up the spasticity on the hand. Okay, soft already. Okay, then you put in the good positioning, then you can put the electrical stimulation for patient to strengthen those muscles. After the patient reduces spasticity, you can ask the patient to do some strengthening. Then this is the step to reduce the spasticity. Okay. Clinical research in here also say that, which is this say that electrical stimulation in reducing the post-stroke spasticity, right? And another study also say that combination electrical stimulation with stretching, it will help to reduce the spasticity rather than just one treatment. Number third, reduce swelling. Stroke patient, they will experience swelling on the hand, elbow, or ankle. Why? Because the muscle cannot move. When the muscle cannot move, no pump, we so-called pumping. Our heart is another pump machine in our body. So when the heart pump, the blood is circulate. But how about the leg? How about our hand? When the muscle is not working, less pump on our body, then the blood will be sustained over the part, then cause swelling. Then patient not able to move. If family members have free time or patient able to, whenever the patient who are disciplined, they will keep moving. Keep moving also help to pumping. Other than that, you also can use electrical stimulation to stimulate the sensation on the joint, muscle tendon, or to strengthen it with the electric current. It also will help to reduce swelling. Okay, how to put? Okay, from the photo, you can see the first photo. If the patient experiences the hand swelling, then you can put two electrodes on the wrist and the hand. Okay, then let it pump. Let it have an electrical stimulation. Then muscle will contract. Once muscle contract, how? Blood flow will start. Then it also help to reduce the swelling. Okay. Second is the place we put on the elbow. For those experience elbow swelling, also can put hands on the elbow to reduce the swelling. Some people will say, hey, why use TENS, not use EMS, or you not use any EMS in the stroke patient? For my advice, swelling, sometimes like as I just now I say, muscle weak or muscle didn't move is swelling, one point. Second point is maybe patient injured, we don't know, because patient is less sensation on the affected side and the stroke side. So if we do EMS or NEMS, the muscle, the electrical is too strong because the movement is too strong, then it maybe will cause hurt for the patient. So this one is depend on the condition. If the after your patient or your family members who have stroke is diagnosed with swelling due to didn't move, okay, you can use NEMS. But for those that diagnosed or maybe due to certain movement or certain injury, it's better put TENS. This is a safer. Okay. Other than TENS, we also can use ice, cool. Cooling, which is let the muscle contract, right? When certain thing that make cold weather or cold therapy, the muscle will be contract. This is one thing, stimulate or activate the pumping. So we also can use cold therapy to reduce the swelling, and massage, right, from the tip of finger massage to the wrist is also another type for reduce swelling. Then of course we also can use positioning, elevate elevate up the hand, okay, let the swelling reduce through the gravitational pull. Last, of course, now we come out is a hand robot massage. For those they have no free, and then someone hand swelling, don't have TENS or other thing, the hand massage is also helping to reduce your swelling. Okay, come to the clinical evidence. This is a systemic review, which is they study a lot, go through a lot of study or the research, then combine with one journal, found that neuromuscular electrical stimulation is effective in a number of rehabilitation settings and patient group for treatment, either upper limb or lower limb, and it's also helped to we say to reduce the fluid from the muscle. Okay, that's why electrical stimulation still playing an important role in rehab. Okay, last criteria, which is increased muscle strength. Like just now I say, to reduce spasticity, we need to put over the side, which is a weak side. Yes, of course, this is the same technique we need to use to increase the muscle strength. How you can see the few examples here. The first one is for finger extension. As a patient or as a patient family member, we don't know which muscle control which movement, right? It's all right. If you have a TENS, you can try. Try the normal people first before you try on the stroke patient. Okay, you can try. Finger extension, you follow the movement. Okay, we can feel the feeling when we wrist extend, which muscle is bulge. This is a clue, yeah. You extend your wrist, you feel your forearm, which area is bulge. That means that is the area you need to put. For example, I need to put the finger extension. Then I do my finger extension. I feel, oh, here is the area. I feel bulge. So I will put the electrode on this tool, then start the machine. Okay, this is the clue. Okay. Then the second one is for finger flexion. If I want to put finger flexion, I can put on internal part from the forearm. Okay. Then the third is for shoulder extension. We need to put at the back. Okay, because the muscle is over there. For the front, we need to put front on the shoulder. This is a common thing we will be used to strengthen the patient with stroke. Okay, and then of course the elbow extension we'll put at the back, and then the elbow flexion we'll put at the front. Okay, this is the common motor point we will put for shoulder patient. Other than the electrical stimulation, we can combine others treatment to improve their strength. For example, after you strengthen the patient flexion, you can use tools, for example, rubber band or ball to strengthen the patient finger flexion. Then wrist strengthening with a joint proprioception. All these you can use to strengthen the muscle. Of course, last one, we also can use hand robot to strengthen our muscle. Okay, here is a clinical evidence which is improving a hand function of a severely impaired chronic hemiplegic stroke individual using a task-specific training. with the read-in hand system. So-called read-in hand system is a hand robotic things, which is a highly advanced hand robotic machine. The hand robotic machine, which is inside, will build in a electrical muscle stimulation. With this kind of training, patient is more faster to achieve the performance they need to do compared to just electrical stimulation or just robotic, right? So here is another case study. So for those who are therapists here, maybe can try to use put some electrical stimulation on the patient and then combine the task training. When treat the patient, it may be will give a better effect for the stroke patient. And comparison of the training effectiveness of an MES robot and a pure robot. Both are effective in improving long-term functional recovery for upper limb. But if where the robotic combined with the stimulation, it achieves more released muscle spasticity and more improvement in voluntary muscle effort and muscle coordination. That's why just now I say can combine when we treat the patient. It maybe will bring better outcome for the patient. Okay, this is some extra information to let everyone know. In the market, there are a lot of type the brand for the electrical muscle stimulation machine. So how we choose? Actually, we see the frequency what you use. Okay, for example, here 90 to 130 hertz is a pain gate mechanism stimulation for our body. Then 2 to 5 hertz mechanism is also for pain reduction. So the last, if you want for the muscle stimulation, you need to use more than 100 hertz. Okay, these are the three things we can set as a rules. So whatever you use the machine, you open up, you see the hertz, which one you need to use. As I know now also a lot of machine that are built-in mode. Okay, that is a safer. Okay, but for manually, we need to see the hertz, which one we need to use for our patient. Okay, so this is the extra information as if you want to use the electrical stimulation, and then you need to look on this frequency. Then what is the contraindication for using electrical stimulation? Okay, this here is some contraindication. First, pacemaker. As I would say, pacemaker is also a one-type electrical stimulation. So if those patients who are having pacemaker, if you put the TENS near to the pacemaker, it may be will alter the rhythm for the pacemaker. That is the dangerous part. Okay, please remind yourself. Pregnancy. Okay, pregnancy is also because since transcutaneous, it can stimulate the muscle. For example, if inside having tumor or neoplastic tissue, if you put a TENS at the part, it maybe will cause it spread. So need to be careful. Active infection also need to be careful. Then uncontrolled epilepsy, uncontrolled hypertension or hypotension. Electrical stimulation will affect the blood circulation. That's why this is also contraindicated for those patients who uncontrolled hyper and hypotension. Okay, last one is open wound. For those open wound, it's better don't put the electrode. It will hurt you. Okay, this is the video demonstration how you use NMES for the wrist extension. Okay. Okay, how? When we want to put an electrode, it's better to say rub the place if you feel the place is a bit oily or dirty, because if when the skin, there's a lot of hair or a lot of oil or dirty, it will increase, we say, the resistance for the electrode to go inside. Then after that, you set an appropriate parameter which you need to use. You want to use to reduce pain, or you want to increase the muscle strength. You need to set it. Then after that, you on the intensity. You see, when the intensity is on, the muscle start to move. So at the same time, you also can educate patient to move the wrist up when the electric is coming to the muscle. Okay. Okay, this is the sharing for today. If you have any question, you can write inside the chat box, and also can open your video and ask us. Thank you.
All right, thank you, Yvonne. Right, you can you unshare your screen? Maybe we have both of our kindly help us to spotlight both our video. Can you stop sharing, Yvonne?
Okay, sure.
Hi, Chia. Good afternoon. Yeah. According to experience, okay. Maybe you can turn on your mic. You can ask directly. Is it okay? Right.
Oh,
great.
Hello. Can you hear
Hi.
me?
Yes, we can hear you, Chia.
Oh, hi, Yvonne.
Yeah.
Can I ask you, right, based on your experience or those articles you have read, like if we do NMES for stroke patients, right, especially for them who have like muscle strength 0 to 1, normally how long we do, then we can see the progressions. Like if we combine with those stretching, strengthening exercise, normally how long it take?
Okay, okay, as my experience, it depends. Some they take 1 month, some they take 2 weeks. For in my hand, some they 2 years 2 years after stroke. Have any movement through the stimulation and also the robotic, because the robotic keep repeating the movement. So 1 hour they can do a lot of repetition. Then after that, maybe 2 weeks, I go to see back this patient, the finger is start to move a bit.
Oh, okay.
But they cannot just depend on our physio section. After physio section, the patient also keep on doing the hand robot, right? Then when we come, we don't want to use hand robot. Just leave the hand robot to the patient. Then after you checking, oh yes, the patient is improving after 2 or 3 weeks, within 1 month.
Okay, thanks.
Welcome.
Right. Thank you, Chia. I mean, this is kind of like quite very subjective. It really depends on the patient, but based on your experience, like 2 weeks, we can see some progress if patient starting to do at home as well. Like we can't really rely on patient to do during the session right after that. And you mentioned about the hand robot that time. So it seems like it really require a lot of intensity. The robot assists, is it? I mean, can I just without the robot, I just put the electric stimulation and then I just like, okay, can I expect a recovery from that? I mean, as a
my experience, if you just depend on the electrical stimulation, hard to see the result.
Hard to see the result.
Why? Because patients don't want to use their strength.
Okay.
We maintain the muscle strength, but we didn't let the plasticity to going on. The patient had to improve the strength. So the strength will be, if like 0 to 1, the patient just 0 to 1. Even though the muscle strength didn't reduce, okay, but still at the end, you need to ask the patient to move.
Still need to ask the patient to move in order to, so it's a combination. It's not just like passively, we just put it there and then we expect it to help us to do the work, is it? So it should not be that case. So it should be a combination of effort from patient, right?
Yes, correct.
Understand. Right.
Because plasticity will going to, if the patient do more, patient voluntarily do more, the plasticity will be happen on the brain. So if the patient able to do like 500 or 100K repetition. The movement will be received by the brain, then the patient has to do it. Then we will gain back the movement.
All right.
Okay.
Thank you, Yvonne. Hi, No Diana, you can open your mic. Feel free to ask your question here. Do you mind? You want to open your mic to ask directly? I'm sorry. Okay, no worry. I can read out the question for everyone. So, if someone who felt weakness of their hand or feet but do not have stroke, is it possible to get electric stimulation for the treatment, or it can cause harm for them?
Okay.
Thank you, Diana, for your question. What do you think, Yvonne?
Okay. For muscle weakness, it's not a stroke patient. It need to depends on the age for the patient. If those who are elderly, maybe the muscles start to we call degenerative, then it become weak. The muscle fiber, we got two types of muscle fiber. Maybe one type of a muscle fiber is start to reduce. So of course, you use electrical stimulation with tolerate intensity for muscle stimulation. It will help for this patient.
Okay.
Because muscle fiber, they have two types. One type, if you didn't work more, you're using more the muscle, it will start to reduce the muscle fiber. So through the electrical stimulation, yes, it will maintain the muscle bulge on the muscle. So it will help to overcome the weakness.
All right. Diana, feel free to write if you have any other questions. So I hope this answers your question. Well, regarding on this question, I was thinking, let's say you mentioned that it can help on some muscle weakness, right? I was thinking, let's say, is it possible for us to improve our muscle strength if we did not do exercise with this? We do electric stimulation, you know. I mean, for like now, a lot of people at home and did not go for exercise. Is this helpful for? I mean, electric stimulation helpful for that kind of?
It can be
Just,
helpful, but just we can say maintain.
Understand.
And then so that's why now technology is come towards a part which is we don't need to go gym or we don't need to build our six pack, but with some injection for the some nutrient to the muscle, and then with the EMS it help to build the six pack.
Understand. Okay.
But how call it is quality? Is it able the six pack person can able to lift up 100 kg dumbbell or the barbell? Maybe impossible. Because that one is just use electrical stimulation.
I see. So it seems like based on what you mentioned, electric stimulation is like an assistive stimulation for the muscle. And actually, we can't really make it like a core, but actually the main core is still our muscle training of the patient training example. That is still the core of the treatment, is it?
Currently, yes. For in future, maybe 10 years, there are a lot of technology coming in, more research coming in. Maybe some frequency or hertz, it can help us to maintain our muscle voluntary movement without we doing some movement. Yes, maybe in future, but not now.
Understand. All right. So we come back to the topic here today is more on the stroke. Let's say if let's say for example just now Diana mentioned weakness or let's say family member at home, or you mentioned it can be helpful for different kind of conditions, spasticity, etc. But what is the safe dosage I can do? Can I do like 3 times a day, 5 times a day, or 1 week? Or every day I can do it? What do you recommend a safe usage at home?
For recommended, you can see a lot of journal, they will say 2 times per day. For those that didn't go for any physio or didn't go to treat their pain, but they have the machine, they will use 2 times per day, and then 2 to 3 times per week.
2 to 3 times per week. It's not every day.
Every day, not every day.
Understand.
Then about the hours, I think now, this one is a manual. We call manual. For now, latest the machine, they are setting the mode.
Okay.
Without adjusting the frequency or the hertz, everything. So this is the safer lah for
Okay.
buying from others company.
All right. I have another question from the participant. So the question is, what if the patient has the subluxation on the shoulder, which is common in stroke? Does electric stimulation help in shoulder subluxation?
Yes, it helps in the shoulder subluxation. But shoulder subluxation, as I just previous webinar we have shared before, maybe 2 finger, 3 finger, or 4 finger, we don't know. But with the current stimulation, it's better put in a position which is suitable for the patient to have received the electrical stimulation. That will be helpful. If you put in a position, in the lying position, then hand put at the side, maybe the stimulation is cannot receive by the brain, maybe because due to pain. Is it the pain can overcome by this electrical stimulation? That one is depending, maybe due to the electrical stimulation intensity too low, maybe the hertz not right. So there is so many things we need to concern. So positioning for subluxation is important when you're using the electrical stimulation.
So Yvonne, you mentioned about positioning. Maybe you do a quick demo. Is it like I should rest my arm at the chair beside, or it's like an armrest? Is it positioning?
Yes, that's good. It's a good positioning for sublux because it's a shortening of the deltoid muscle, right? As we know, deltoid muscle is over here, then the bicep tendon and tricep tendon. So if you're in a lengthening position to do electrical stimulation, maybe that is not so good or not so effective. So in a shortening muscle, it will be good when you're using the electrical stimulation.
All right, thank you, Yvonne. Another question is how to use electric stimulation correctly, and what is the common mistake you can see, and would you suggest what is the do and don'ts?
Do and don't, I can see mainly is patients sometimes feel nothing because they didn't rub the we call the skin before we put the TENS, the electrode. So patients sometimes feel not so much the intensity, first thing. Second thing is some patients will say they put a lotion, for example, they put lotion which is white cream, then they put the TENS, or then this happening, what happening? Chemical reaction. Then the skin will have an injured. Chemical injection, the chemical reaction. So I advise is it's better you rub first. If those patients like to put the cosmetic, right, or lotion or oil, then we put the electrode, it may be hurt. Okay.
All right, thank you, Yvonne. Chacha, yes, we can share maybe in the email later on. She's asking for the articles, right? Ken, so the next question is on, let's say if a family member, they want to buy a electric stimulation at home, example, what is the, how should we know is right for us? Any suggestion would you suggest? Like which one is, how to choose, like?
Follow back, if you have a therapist beside you, or you have a therapist can guide you, and that is a safer way, because we don't know which patient suitable which intensity or mode. So it's better have an advice to check your family members, what condition is it suitable to buy this and that, then okay.
Understand. All right, thank you. The next question is, I think, coming from a therapist. Can you explain on how is the difference between modulated burst mode in the electrical stimulation? Does it have different effect on the users?
Yes, there has even effect. As I my 10 years or 9 years, 10 years back, when I studied theory about TENS, last time is acupuncture, conventional, and burst. Now is burst, moderator, and continuous. There is the, what is the difference between that? That's why today webinar I didn't share about these three types. For continuous, which is as we know, the wave is continuous. So for example, my muscle is here, then it keep like this. It won't down. Maybe if you put more than 100 hertz. So if I just want to reduce the pain, so I won't do more than 100 hertz. So my hand will be like this.
Okay.
Have a reduce the pain effect. So it's all right to use conventional, continuous or burst. But for electrical stimulation, muscle stimulation is better use burst or moderate. It depends on the patient field.
Depends on their field. Means that if they don't have the field in burst, they can use modulated. If modulated don't have the field, they use the burst. Am I correct? What you mentioned?
Yes, because for burst, it's more sharp pain.
Sharp pain.
Yeah, burst people usually will feel sharp pain, a bit like pricky pain. So that one is more high sensation for those who less sensation.
So do you mean kind of like burst is a higher sensation, and then the moderated? So normally we will start with the moderated mode first. If they don't feel much, then we can use a burst mode. Is it? So both of this is NMES is not tense, is it? This mode is inside.
Oh no. Just now is what we say about the conventional, continuous burst. All is under tense.
Okay.
All is under tense. Okay.
Understand. Okay. All is under tense.
Stimulation is burst.
Okay. Sorry.
For muscle stimulation, we usually use burst.
Okay. For muscle stimulation, we do okay.
Okay.
So for the pain is normally use the modulated. Am I correct?
Yeah. Right.
Understand. All right. Great. A little bit technical. Thank you for the sharing. I learned a lot today. Right. Another question is, let's say if they mentioned, is it okay if patient complain pain and they use TENS as a pain relief in the affected arm using TENS? I think you mentioned this in your slide. So yes. Patient they are pain, then can they use like TENS to release the pain?
Yeah, because the purpose is to reduce pain. Of course, like just now we say, better choose moderate.
Okay.
Because if like burst is the sharp pain, maybe will cause patient feel the pain is aggravated. So it's better put continuous or moderate.
Understand. So we talk about, I mean, this is more on today is more on the sharing session. Right, based on your personal experience, Yvonne, today we talk about stroke, how we can improve their hand recovery using the electric stimulation. Based on experience, what is the best combination for you in your practice? Like how do you can see the best result in combination? How do you normally approach on hand recovery for stroke? I mean, yeah. Do you mind to share?
Just now I sharing about stretching first, then
okay.
By electrical stimulation, then functional or movement training. This is treatment way when come to the stroke patient. At the end, still go back to functional training.
Functional training.
The beginning, patient not able to achieve certain movement, we call single movement. Single movement not yet achieved, is better have electrical stimulation to let the muscle awake. To let the muscle know that the owner still need to use the muscle. So electrical stimulation is still important when treating for the neurologic cases. They say neurologist, that means something is nerve. Nerve is depend on the sensation. If you didn't give the electrical stimulation, maybe you need to give some sensation to that part, maybe eyes, maybe soft cotton, or maybe pointing things, all this, because sensation still playing important roles in neuroplasticity.
All right, thank you, Yvonne. The next question is, will electric stimulation, if you use that, will patient rely on the electric stimulation? Then yes. Once we release that, and then it won't have, will this happen?
Yeah, that will be happen. That's why it's preferred to combine.
Oh, okay.
That's why I prefer to combine at the beginning. Maybe is why I prefer start with electrical stimulation first, because at the end we didn't use it.
Okay.
So patient won't say, oh, I have an electrical stimulation, then I do.
Understand. Okay. So another next question is when you mentioned we should start based on this condition, and then when is the time we should stop giving patient electrical stimulation? Is it they have a little bit movement, they should not use the electric stimulation already, or based on your personal experience, when do you think is the time we should stop using electric stimulation?
Okay, based on my experience, usually if patient able to do a lot of functional tasks, I won't use it.
Even though they are not able to do I mean some of them. Sorry, continue.
But if like I continue for maybe 2 or 3 sections, the improvement is still maintained, maybe I will use the electrical stimulation.
Sorry, can you repeat again? If the
patient able to do the functional task a lot, then I will stop to use it, the electrical stimulation. But until certain, maybe few section, patient not able to achieve certain tasks, I will use back the electrical stimulation.
Okay, so means that there's a muscle weakness then, and then you try to trigger more to help to complete that functional movement that you want to achieve.
Yep.
Understand. All right, thank you. We still have 4 minutes left for the Q&A session. Our admin can share the feedback link here during the session, I think. So we're going to have the link. You can fill up the feedback form while we take the last question on the floor. Is there any other question on the floor? Do you have? So Chaja mentioned, can you request for the link? Yeah. Okay. So anything you want to share with us, Yvonne? I mean, last word things regarding on the topics today. Do you want to share with our audience?
Yep. Electrical stimulation, I think still a lot of physiotherapists or sometimes feel like electrical stimulation is not so effective for patient. Actually, for certain time when we treat the patient for 1 or 2 years, if patient still doesn't have improvement, we shouldn't stick to one technique. We need to change or modify our technique to make the patient have some improvement. This is what my advice. So for family members, electrical stimulation still a bit dangerous. As I say just now, maybe they put a cream. Usually for stroke patient, they have a dry skin. So patient will put lotion for patient. The patient family members will put the lotion for them. Then when they do the electrical stimulation, maybe it will burn or chemical reaction on the skin. So that should be avoided. Okay, so it's better for patient or those who are not in medical, it's better don't have an advice before you use the electrical stimulation.
All right, great. Thank you, Yvonne. So today's session is, thank you very much for your sharing. I learned a lot today. I did not realize electric can reduce swellings. That is very interesting. And you mentioned that combination, I mean, I put in the summary and mentioned electric stimulation, not only we can strengthen our muscles, also can be used for spasticity reductions, also reduce swellings. Also, we can, in fact, improve the shoulder subluxation as well. But really, if you want to use at home for family member, then please refer to your therapy so that to advise you based on your current condition. Right? We have the link today on the feedback. You can fill up the form, and if you would like to get the certificate, you can choose the option there, and then we will send you the certificates for your personal record. All right. So lastly, I would like to thank Yvonne. Thank you very much for your time. I know you spent a lot of effort. Yvonne actually spent a few weeks in order to go through all the information on the latest technology, and EMS actually keep evolving, and we still a lot of information out there, and we hope the information today helpful for all the audience today. And thank you very much, Yvonne, for your sharing. I wish All right. I wish all of you today. Thank you for joining us. And our webinar. This is our last webinar this year, and after that we may have 3 to 4 months once of the webinar on adjustment. All right. We hope that we can continue to share useful information for you. And take care and have a great day ahead. Thank you. See you.